Hello, dear doctors. Nice to meet you. Dr.MedEx Indian Medical Society. Dr.MedEx Indian Medical Society is going to start MCQ based on the dermatology. Hope you people are fine. I'm fine too. Thank you very much. Today we are going to start question number 1 of dermatology. Which of the following is causative agent for acne fulminans? Acne fulminans, So the option provided A, B, C, D. Yes, please tell me which one is the answer. Yeah, please tell me. Yes, you are right. Propionibacterium. Yes, this is the answer. Okay. Propionibacterium. Propionibacterium acne is believed to be responsible for acne fulminans. Yes, nice. Thank you very much. Come to the question second. Okay. Come to the question second. Question second, a very easy question. You can imagine from the face. Just try to pay your attention on face. After that, you will get some information. Okay. This 25-year-old pregnant female presents with a dermatology OPD. Of course, she is pregnant and she is coming to see you in the OPD and asking, doctor, nowadays I am having this type of rash on my cheek. Please tell me what is this. So you are a doctor in the clinic and you are responsible to find the cause and what is it and diagnosis. Okay. The woman here, this woman here is presenting with, option is SLE, melasma, rosacea, and chloasma. Okay. So out of this woman here is presenting with chloasma. Okay. This is chloasma. Okay. Option D. And this mask, okay, of pregnancy. Okay. Pregnancy. The same facial melanosis in non-pregnant women is called melasma. This is in the non-pregnant woman. Okay. Woman. If in our case history this point is available pregnant, then it is chloasma. If this woman is not pregnant, then this is melasma. Okay. I hope you can understand it very well. If you don't understand, please let me know. I will explain it twice. Okay. Only the term used differ here. Melasma is most common cause of facial melanosis. This melasma, okay, is most common cause of facial melanosis and is manifested by hyperpigmented macules on the face, which become more pronounced after sun exposure. So melasma is related to sun exposure. Okay, exposure. Melasma is related to sun exposure. Okay, I think it's very clear. Hypermelanosis affects mainly the upper lip. Hypermelanosis mainly affects the upper lip, the malar regions, the forehead, and the chin. Whereas the chloasma, okay, this chloasma is very common in the third trimester of pregnancy. Here in the question is not written the first trimester, second trimester, or third trimester, but it is clearly mentioned. They can also mention in a question that third trimester. Okay, third trimester of pregnancy. And melasma frequently seen in the woman on oral contraceptive. So this melasma is actually, if anyone is taking the oral contraceptive, then you can find the melasma. Okay, I hope it's very clear. Chlasma self-resolve. The chlasma, this one, chlasma self-resolve. Okay, self-resolve after pregnancy, but melasma is more chronic and requires treatment with depigmenting agents. Okay, so this question is very, very clear. There is a key feature that melasma is present in non-pregnant women and also because of sun exposure, but asthma mask of pregnancy, that is also the self-resolve after the delivery of the baby. It can resolve itself by itself. And melasma is also because of oral contraceptives. A female who is young and taking the oral contraceptive after having the sex, so it might be possible that that woman would have melasma. Okay, so it's quite clear to everyone. Don't confuse over here. Okay, come to the question number 3. Okay, question 3. Yes, all of the following show Koebner phenomena. All of the following show Koebner phenomena. So please tell me except. Okay, Koebner phenomena except. So our best answer is herpes. Okay, herpes, there is no Koebner phenomena. Why? Herpes does not show Koebner phenomena. Herpes phenomenon isomorphic response is the development of lesions in previously normal skin that has been subjected to trauma. If the same response is seen from the spread of an infective agent like molluscum contagiosum, viral warts, is called pseudo-Koebner phenomena. Okay, so best answer is herpes. Come to the question number 4th. Okay, question number 4th. Question number 4th. Very easy and very good and diagrammatic picture. You have the image. What is used to diagnose the condition given in the image? What do you use? So it's very used. You have heard most of the time teacher in your class, anywhere, either in the video lecture of the derma classes, you have heard this one. Okay, wood lamp examination. Wood lamp examination. What? Wood lamp examination. The given image shows sharply demarcated hypopigmented macules pointing to a likely diagnosis of tinea versicolor or pityriasis versicolor. A wood lamp is used to diagnose the condition. Lesions show a pale yellow fluorescence when examined under the lamp. The basic diagnostic technique for tinea versicolor, okay, is KOH culture or wood lights. Okay, come to the question number 5th. Okay, question number 5th. Very good and very nice question. 5th question. A patient comes with silvery scale. See, very important point. In the first sentence only you find the key point. Okay, erythematous plaques. Okay, so no problem is erythematic plaque. Okay, but silvery scale over the extensor, no matter where. But now, first of all, it should be at the extensor, pitting on the nails, and involvement of the scalp is also noted. These findings are consistent with which diagnosis? What do you think? Lichen planus, psoriasis vulgaris, pemphigus vulgaris, and ichthyosis vulgaris. So our best answer is yes. Please tell me. Vulgaris. Which vulgaris? There are 3 vulgaris. So there is psoriasis. Psoriasis vulgaris. Option B. The following clinical scenario is suggestive of psoriasis vulgaris. Why? Because it is a type of psoriasis. Okay. Clinical feature erythematous plaque. with silvery white scaling. The first sentence is giving you the key point to find the answer and select the options A, B, C, D. The key point, that is the clinical feature, is the silvery scale, silvery white like scaling. Okay, extensor, especially extensor are involved, especially extensors are involved. So first of all, silvery, okay, silvery white, okay, silvery white like patchy scaling, okay, okay. Extensor are commonly involved. Which part? Extensor. Extensors are commonly involved. Okay, extensors are commonly involved. Okay, extensors are commonly involved. Nail changes in psoriasis and nail changes. Yeah, most common nail changes is pitting. Most common nail changes is pitting. Okay, the most characteristics is the oil drop sign. Most characteristics is the oil drop sign, salmon patch due to the defect in the nail bed. Clinical sign, auspicious sign, pinpoint bleeding spot in rubbing the lesions, Aronoff ring and Berkeley membrane is same. Berkeley membrane is. Come to the question number 6. Very good, very good, very good. Nice to hear from you people that you are understanding. Okay, a patient. Okay, multiple painful blisters. Which type of blisters? Multiple. So many blisters. See, so many blisters on the trunk. This is the trunk of any person, a patient, shown in the image. Identify the organism responsible for it. Okay, a patient is coming to your clinic, you are a doctor, you are sitting in the OPD. Of course, the patient will come and complain to you, doctor, my dear doctor, sir, I have this problem, please see my trunk, there are a lot of multiple painful blisters. So what do you think? Okay, what do you think? Okay, so there is option A is the herpes zoster, option B is the chicken pox, option C is the measles, option D is the SID. Okay, option A. Okay, option A. Option answer is option A, herpes zoster. Why? The above image shown multiple painful blisters on the trunk along the dermatome, which is suggestive of herpes zoster or shingles. Okay, it is due to reactivation of the varicella zoster virus. It is due to why? Varicella zoster virus. Okay, in the nerves in adult. Okay, varicella zoster virus in the nerves. Okay, in the nerves, the adults, which is called shingles or herpes zoster. Presentation: unilateral fluid filled lesions along the dermatome region. So most of the time, whenever this type of symptoms appear, and you are a doctor, and patient is coming to you in the clinic, and you don't only find the diagnosis and ask the patient, okay, I know the diagnosis now. I'm telling to you diagnosis. This is herpes zoster. Now you go back. No, 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 no. You have to give him the medication. Okay, you have to give him medicine so that he will feel relaxed after some time. Okay, so what is the drug of choice? Drug of choice. Okay, drug of choice for herpes zoster is acyclovir. There is only one vir who can ask the herpes zoster, now I am coming to see you, and now you have to go and say bye bye, bye bye herpes zoster, I am coming to you, I am coming to your body. Acyclovir, herpes zoster, acyclovir, herpes zoster, go back, go away, I don't want to see you anymore. Okay, so what is the drug of choice? Drug of choice is herpes zoster. Drug of choice, acyclovir. When acyclovir will come, No herpes zoster at all. Okay, herpes zoster have to go away. Okay, come back to next question. Question number second. Okay, yes, this question is telling to you this female is also very young, 25-year-old female, presenting with the following image given here. Dermatology only image. Okay, if you want to study derma, must focus on the image. What is the primary lessons of the conditions? What is the primary lessons of the condition? Question number 7. The above given image, this image, above given image shows comedons which is seen in the acne vulgaris. Okay, seen in the acne. Okay, vulgaris, acne vulgaris. Okay, most common form of acne. This is acne vulgaris is common form of most common form of that is acne. Most common form of acne. Okay, most characteristic lesions. What is most characteristics lesion? Comedons. Okay, comedons. So what is the answer? Comedons. A 25-year-old female is presenting with the following image. What is the primary lesions following conditions? Lesions of the following. What is? This is come. Okay. Come, do once. Okay. Comedons. That is only one word. Comedons. I'm telling to you just to teach you. Come, do once. That is comedons. Come, do once. That is comedons. Okay. Okay. Now it's clear. Most severe form of acne vulgaris is grade 4. Most severe form of acne vulgaris is which? Grade 4. Most severe. Okay. Most severe. Most severe form of acne is acne conglobata. Okay. And drug of choice is, what is drug of choice? Drug of choice is, what is drug of choice? Oral. That is oral isotretinoin. Okay. Isotretinoin. Okay. So this is drug of choice for comedons. Okay. Thank you very much. Come to question number 8. Question number 8. Very good and very easy question. A patient, always patient, no matter what age, always some age, male or female patient coming to your OPD presenting with the itching lesion. This time this patient is coming with the itching lesion. Where? Somewhere wrist involvement of the oral mucosa, and on the examination the following findings will be noted. Okay, following findings will be, oh, this type of, see, this type of lesions you can find. Question 8. Okay, this type of lesion you can find. See how this type of lesions are found in the body of this patient, young patient. So what is this? A. Lichen planus, B. Lichen nidus, C. psoriasis, and D. chickenpox. Okay, so what is it? Lichen planus. And the above given condition is seen in the lichen planus. It is an autoimmune condition. Clinical feature, what is this? A skin, plain purple polygonal pruritic papule or plaques. Mucosa, lacy reticulate pattern. Nails, pterygium, hair scarring alopecia or cicatricial alopecia. Hair of the patient, scarring alopecia or cicatricial alopecia. Skin lesions have the reticulate pattern known as Wickham striae. Okay, associated with HCV. Okay. Question 9. Come to the question 9. Question 9. Very good question. Auspice sign is seen in. Auspice sign is seen in psoriasis vulgaris, pustular psoriasis, pemphigus, and bullous pemphigus. Pemphigoid. Okay. So what is question? Psoriasis vulgaris. Psoriasis vulgaris. Auspice sign is characteristic feature seen in psoriasis. Come to the question number 10. Come to the question number 10. Come to the question number 10. Okay. Yes. A young male presents with the leg lesions shown in the image below. On the examination, the lesion painful and the edges are well demarcated and raised. He also complains of blister over the body. He otherwise normal and does not have any other disease. This infection is most likely to be caused by which of the following organism? Okay. 10, which organism? Okay, come to the C. See here, see here, see here. Okay, see. So, what is the answer of this question number 10? 10 is the question 10. Group A, Streptococcus. Group A, Streptococcus. Come to the question. Question 11. A 40-year-old female comes to with a complaint of pain in her fingernail on examination. Nail folds were seen to be red and with erythema as shown in the picture. The most common likely diagnosis is, okay, see, most common likely diagnosis is, what is the diagnosis? Especially it is in the nail folds, especially on the nail folds seen in the red and erythema as shown in the picture. So this is acute suppurative infection of the nail bed. This is the nail bed. Okay, this is the nail bed, and see this nail bed. See how is the situation is going on with this person. Acute suppurative infection of the nail beds and folds is called the acute paronychia, and it is mostly commonly caused by the Staphylococcus aureus. Caused by caused by which? Please tell me. Yeah, Staphylococcus aureus. Caused by Staphylococcus aureus. So what is the answer? Answer of this question is paronychia. Come to the question 12. The girl seen in the image has had the history of severe sunburn after just few minutes in the sun and severe freckling in the sun exposed area. The most likely diagnosis is, yes, please tell me, most likely diagnosis is Xeroderma pigmentosum. Most likely diagnosis is Xeroderma pigmentosum. Why? The image shows here a girl with a Xeroderma pigmentosum. It is characterized by the defective nucleotide excision repair. Which one is have problem? Characterized by the defective nucleotide excision repair that is transmitted autosomal recessively. Okay. Come to the question number 13. Okay. Question number 13. Which of the following side effects are seen most commonly with isotretinoin? Question 13. What is the answer? Cis-13 retinoic acid, also known as the isotretinoin, is a vitamin A derivative which is highly teratogenic when orally administered. It is commonly used to treat cystic nodular acne. It inhibits the migration of the neural crest cells during the embryogenesis and affect the development of the multiple organs. These defects are collectively termed retinoic acid embryopathy. What is? Answer is here, D. Okay. Which of the following side effects are seen most commonly with the isotretinoin embryopathy? Okay. Come to the very easy, and most of the time they ask question like this. A 30-year-old female came with the chief complaint: vaginal discharge, lower abdominal pain, tenderness. Which of the following kit? Of course, you know the kit. Okay, which of the following kits? So yellow kit. Okay, come to the question. Next question. 15. Okay, question 15. Very easy question. Most of the time they ask. A patient came with a complaint with the diarrhea, dermatitis, and mental retardation. It was also found that he was maze eater. What is the probable? Of course, what is the probable maze eater? And all the symptoms are given here. Has been given. So pellagra. C, option C, pellagra. Pellagra is a niacin. Pellagra and niacin. Okay. Which vitamin? Vitamin B3. Which vitamin? Vitamin B3 deficiency that leads to the diarrhea, dermatitis over sun-exposed area, especially the dementia, and death is not if not treated. Okay, diets rich in maize, jawar, predisposed to pellagra. Excessive alcohol consumption, carcinoid syndrome, and Hartnup disease can also lead to pellagra. Okay, so there are so many risk factors. Okay, come to the question number 16. Again, always patient. Of course, who will come to you? No one will come except if that person is not suffering from any disease. A patient as 25-year-old presented with a hypopigmented macules over the back and upper trunk. On the KOH mount, a spaghetti and meatball appearance. A spaghetti and meatball appearance was seen. What can be the causative agent? A spaghetti and meat. Of course, this is very easy question. Malacia for okay. I'm not going to explain too much detail. But pityriasis versicolor. Pityriasis versicolor, also known as tinea versicolor, is caused by Malacia furfur. Tinea versicolor. Tinea versicolor is a fungal skin infection that commonly appears on the face, neck, upper arms, chest, and back. Skin affected by tinea versicolor can appear lighter, darker, or redder than surrounding skin. Question number 17. Come to the question number 17. A patient has dactylitis of the multiple digits on toes with sharply demarcated red papulosquamous lesions on both toes, all of which point towards a diagnosis of the psoriatic arthritis. Which of the following treatment will be given? Which treatment you will give? Methotrexate. Of course, I will give the methotrexate. Why? Diagnosis of psoriatic arthritis, multiple digits on the toes, red papulosquamous lesions, so both toes. Okay, that is why giving methotrexate and apremilast. Methotrexate and apremilast are the first line of drugs for the treatment of moderate to severe psoriasis associated with psoriatic arthritis. Features of psoriatic arthritis are asymmetrical or oligoarthritis associated with the nail pitting, onycholysis, or dactylitis or enthesitis. Inflammation is prominent in distal interphalangeal joints. There is a dactylitis with a pronounced telescoping, nail dystrophy, hyperkeratosis, and onycholysis affect each of the fingers. Radiological feature: pencil in the cup deformity of DIP joint, marginal erosions with adjacent bony proliferation, whiskering small joints, ankylosing. Come to the question number 18. Answer is methotrexate. Okay. Question 18. For a lesion faced on the shown in the above image, which of the following is not risk factor for the causation of the above disease condition? Okay. What do you think about this? Okay. This condition. What do you think? What is the answer? Please tell me. Yes. For a lesion on the face shown in the above image like this, this is the answer. Okay. Dark skin type. D. Basal cell carcinoma is locally invasive epidermal tumor made of a basalvoid cells and it never metastasis. Etiology include the UV rays, chemical genetic predisposition, xeroderma pigmentosa, UV exposure, and defect in the DNA. repair mechanism, albinism, fair skin, nevoid BCC, multiple BCC inherited as an autosomal dominant form. Morphology is typical of the ulcerated nodular or rodent ulcer with beaded margins and telangiectasia. Variants of BCC include nodular ulcerative, superficial, pigmented, and morphoic. Treatment of BCC is surgery or surgical excision. Okay, this question is for you. 19 number. You will try your best. Okay. For the image shown in the below, which of the following is incorrect? Image shown in the below. This image, and you will tell me the option A, B, C, and D. This is for you. Please tell me what is the answer, correct answer. Okay. The image shown here, a tombstone appearance characteristic of Pemphigus vulgaris. Which one is Pemphigus vulgaris? Pemphigus vulgaris is the most common blistering disorder. Pemphigus vulgaris, most common blistering disorder. Pemphigus vulgaris is most common blistering disorder. Okay. Pemphigus vulgaris most common blistering disorder, which is there is a autoantibody mediated destruction of the desmosomes due to the attack at the desmoglein 1 and 3. Desmoglein 1 and 3. So please try your best to find out the answer of this. Okay. Come to this point. A 27-year-old female presented with a clinic complaints of the multiple papules, pustules, comedones on the face and upper back for few weeks. The lesions have a gradual onset and occasionally flare up. She is 10 weeks pregnant. Picture of the patient lesions is shown below. Which of the following is contraindicated in the patient? So, what is the answer? Answer is, please tell me answer. Answer is D. That is both A, oral tetracycline and oral isotretinoin. Okay. Come to the question number 21. Okay. Come to the question number 21. Yeah. Please tell me this question. That 35-year-old male presented with a painless ulcer on the glands of the penis and diffuse rash on his palms and soles. The ulcer appears about 3 weeks ago and healed spontaneously, but the rash developed about a week ago. He reports no other symptoms and has multiple sexual partners. Which of the following is the most appropriate treatment? 21. Treatment is C. Benzathioline, penicillin G. Okay. 22. What is 22? Answer of 22. 22, a 25-year-old female presented with hair loss started about 6 months ago. She reports noticing increased hair shedding when brushing or washing her hair. Has also noticed thinning of her ponytail. She also been on the thyroid medication for the past 1 year. On physical examination, there is diffuse hair. There is diffuse hair loss without any visible scarring. Which of the following is the most likely diagnosis? Is the most likely diagnosis? Please tell me. Telogen effluvium. Telogen effluvium. This is okay. So yeah, please tell me, this is the anatomy of these mallet fingers. You will read about it. This is homework for you. Mallet finger. I have especially put the anatomy so that we will have a little bit knowledge about the anatomy mechanism. Forced hyperflexion, distal phalanx or the volleyball, basketball like this. See here, and this is the flexion of the deep splint extension for 6 to 8 weeks. Complications: swan neck. See swan neck, and here is the lumbar. This is the lumbar plexus, vas major, right lateral and cutaneous nerve here. Left lateral cutaneous nerve of thigh. See here. So these are the few important. So this is all for today. Thank you very much. If you like it, share it with your friends. I hope your friends will also get some advantage because of you and because of me also too, of course. So we are going to stop it here. Thank you very much.